Hi everyone, thanks for joining us again today. We are in our series, Protecting Our Seniors and Finding Their Voice. Today we're talking about costs, the costs of long-term care. That is really something that is important to all of us because we are either aging or we have aging parents. And even though we don't want to think about how difficult it might be to place our loved one in a nursing home or an assisted living facility, that is really one of the things that we have to focus on because there's a good possibility that that could happen to either you or your loved one. So first we're going to focus on cost. So the national average, surprisingly, for a nursing home where you have nursing care 100% of the time, you're supposed to be provided with assistance with all activities of daily living, including meals, lodging, of course, either a semi-private or private room. The national average is between $5,000 and $8,000. So that's per month. So that is probably shocking to a lot of us. I know it was shocking when I saw it for the first time. You know, when we're talking about rent or even a house payment, we're usually talking about a lot less than that. So that's an incredible amount of money. And let's say your loved one has planned and saved their entire life. That money that they've saved could very well go to long-term care if you don't plan ahead of time. So just know that in inflation, of course, those prices are going to increase over time. Medicare is always one of those things that we think of that is probably going to pay for everything for our loved one when they age or they are disabled or they need help in healthcare setting. Medicare is limited. Medicare will cover a hospitalization and an incident that happens to your loved one. So let's say your loved one falls, fractures a hip, needs to go in and have surgery. Well, after that time, they're likely going to need rehabilitation services. And depending on the severity of their injury, they may need skilled nursing care. Between 1 and 20 days, Medicare generally covers the full amount of the cost. After that, from 21 days to 100 days, Medicare is going to pay everything except the copayment. And the copayment can be up to $200 a day. So make sure that your loved one has that supplemental coverage through the Medicare programs like Medicare Advantage to cover that additional payment, and ask those questions ahead of time because you want to know what is going to be paid and what's not going to be paid so you can plan. At the end of 100 days, Medicare stops paying for long-term care or rehabilitation services, even if your loved one needs it. So what everyone really should do is just sit down and figure out what kind of plan you can create for your loved one after that 100 days. So you do have some options. There are federal and state funds in a program called PACE. That's the Program of All-Inclusive Care for the Elderly. That is part of our federal legislature and our state resources for elderly, infirm, people that need help, that have disabilities and need long-term care. So that is one of the resources that you have to you. Medicaid is also a resource. So these are programs that are by the federal and state governments that are specifically designed to help elderly patients, disabled patients who have low or no income. So for Medicaid, though, you have to qualify, and there are certain steps that you have to take to qualify for PACE as well. There's also long-term care insurance. This is why planning ahead is really helpful. The long-term care insurance is so much cheaper if you start purchasing it when you're in your 50s and 60s. By the time you get into your 70s, it's more than twice as much. So really look into those long-term health care benefits as well, and just sit down, take some time, go through this difficult process of planning, and you'll feel so much better if you do have a plan when your loved one is hurt or injured or needs 24-hour care. I hope this has been helpful to you, and we'll see you next time.